targeting based on what city projects are going on, like engineering has their TIP projects. We have our capital projects. It also outlines some of the 81 projects and parcels that'll be impacted. And that one right in the middle there is the new 15th Ward project that we've kind of allocated money for in the future.
So what is the purple?
So the purple is what we've identified now on the public side versus the private side. So quick little distinction here, public side of the water service is what we, the water department, the city own and maintain. The private side is what the homeowner maintains. So what we have records on are the public side. Part of the inventory process we have to do is gather information on the private side. So that's part of this project as a whole. So the purple little squares are all the parcels that we have identified right now as having lead service on the public side. Now that's not all of them, because this map of the city, a partial map of the city, shows all those red dots are what we have inventoried on the public side as lead service right now. So quite a bit. Now mind you, even though there are lead services out there, we do treatment to make sure that the lead does not leach out into the water. I just want to make that big point, is that the water is safe to drink. We are doing our due diligence and our effort to maintain the high water quality that we do every single day. So even though there are lead services out there, that is not the contributing factor to, you know, the lead studies that are you see regarding paint and all that.
And I know I was going to try to refrain from this, but just to go along with that statement, just for everybody that's watching and for all of us here to understand, what is there a number to two numbers that you can share to determine what is safe and what isn't safe?
So we follow all the EPA New York State guidelines is 15 parts per million. We can't go below that. We can't go above that threshold. And all of our sampling has come back below that threshold.
So 15 parts per million of the water is your threshold.
So just so that we don't go too far, this 10 million with 60% reimbursement, is that a one-time?
Correct, one time.
And what would, in terms of quantity or at least the value, what would this?
How many could we do?
How many could you do with
So
that?
when we've put forth a project towards a state to, you know, apply for this potential funding, we were looking at, I believe it was 2,200 services to do over the next 5-6 years. And that was to kind of coordinate the efforts between engineering projects, you know, state DOT projects. That way we can contribute. And all right, if you guys are going to get in there and do road repairs or full road reconstruction, let us get in there ahead of you and get our stuff done. Then you guys can come in and pave the road. And that way we're not coming in and digging up a newly paved road just to do a lead service that if we would have coordinated, we would have solved that issue.
I have a question. So when we did the Dig Butternut project 2-3 years ago,
Yes.
were these services put in place?
Yes, so any lead services that were on Butternut were removed as part of that
So
project.
the Butternut Grant Boulevard area, when the new pipes were put in, these were all put in at the same time, or do we have to go back in?
No, like I said, the new water main, the new services, the new
Okay.
hydrants, valves were all coordinated as a Dig Once project
Okay,
for that very point of let's get in there, do it once and walk away and not do it 5 times.
okay.
So all the new services, all the new hydrants, all the new valves, all the new water main for that stretch was done at one time.
Okay.
Oh, I might be getting ahead of you, but the purple spots, if you look at that hot spot over there at the top, all of that purple that is there.
Yes.
Oh, thanks, Amir. So is that so purple because we have identified more there and we just haven't identified those other neighborhoods, or?
So let me jump to the next one because that might show you a little better here. So this is that northern portion. We've identified several projects that we are doing and engineering is doing as part of this. The gray boundary is what we have identified for our investigation area to identify private and confirmed public side materials of these services. Now, engineering has some projects coming up on Teal Street and James Street. We have a project coming forth this fall over at Mosley to redo the pump station. But we're looking at adding a secondary transmission line on Sunnycrest and looking at removing a lot of these lead services as part of that project. But the ones along Teal and James will wait until engineering is ready to do their work, coordinate that effort. So like when they're digging or about to dig, we'll get in there ahead of them, take care of our work, then get out of the way, and then they can get in and do all the paving and curbing and sidewalk.
So I guess what I'm trying to get to is, so if you look at Eastwood to the right of that, right,
Yes.
that part of Eastwood, and there's no purple over there. Is that because we don't know if they're lead services or not, and we are aware over in Melrose, El Dorado?
We have, so this as a bigger picture as a whole, you know, kind of shows you that over in Eastwood, there is less of it. And typically that is because it was developed later on. Lead services were typically used up until 1930-ish,
Okay.
and galvanized was used up until 1950s, thereabouts. So as, you know, those portions of the city were developed during those time periods, that's what they used at that point. Eastwood was brought in at a later date. So it has less of probability of having lead services. Now the purple, you see a little bit of purple dots up there in the corner? I don't know if I can have it over here. Nope, it doesn't show it. So the purple, what we've identified is not copper. So it could be lead, it could be galvanized, or something else, but we don't know, so that's part of the investigation that we need to do, so we can plan for a replacement.
And before we go any further, Commissioner, just two questions. What are the chances in terms of us really getting the grant?
Very good,
Very good?
very good.
Okay, so and then what, so it's 60% reimbursement. Are we gonna bond for the rest of it?
So right, so we have multiple avenues of financing in front of us to do this, what we've kind of identified as a $40 million project. EFC said they'd give us a 0% loan for $12 million, $12 million and change. There's a $10 million grant, but we need to spend like $16 million to get the full $10 million back because it's a 60-40 split. So right now, we're looking to bond for $10 million, I think is what we have, and going to be coming in front of you to start this project, because this is over a series of years. So as we're planning and figuring out, like, where should we be tackling this based on the upcoming projects, we're going to be bonding for that additional funding as we go forward. But what EFC is looking for at this point in time is that we have a project in scope of what we kind of proposed in our report to them.
So, and then I'll be quiet. So what would you say in terms of prioritizing all of this identified areas? How would you prioritize? Because they all got lead.
Everyone needs it. So that's a great question, and that's like why it comes back to our strategic coordination is what we're tackling is what we can piggyback on for other projects. Because one of the biggest expenses for us is going back and paving the road, paving where we've cut. Now, if somebody's already going to be doing a complete mill and pave or road reconstruction project, I'd rather get in there before they do all that work. And then that paving wouldn't be responsible for us. We could then use that extra money that we would have to use for paving to do more services. That way
You're
we
gonna
can-
work with the Dick Ones?
Yes,
kind of
yes, kind of work on that
approach?
same
Okay.
kind of approach through all these different streets.
What does the disruption look like for folks in the neighborhood?
It all
And for
depends.
what period of
how-
time?
Well, that's a great question. It all depends on how much work you want to do. If it's replacing all the water main and all the services, well, the road's going to be kind of sectioned off. Maybe you'll have one-way traffic, or depending on how tight the street is, it might be shut off and then reopened to local traffic, you know, during the day, but at night, everything would be plated so you can get emergency vehicles back and forth. Service interruptions is something that we, you know, prioritize not to do. And if we have to take a whole water main out of service, we would likely put in temporary water service so everyone can maintain service in the house. And then once the new water main is installed, we would then make the new service taps into the new water main and transfer all the services over. So we're never going to be looking to put people out of water for extended periods of time. That's just not feasible for us to do. You know. So this is our scope of what we're looking at to coordinate with projects in the north, on the north side of the city. You can see down there towards 690, the items in red is what the New York State DOT is going to be doing as part of Contract 4. On the south side of the city, engineering has a project coming up on Midland Avenue next year, I believe. So we're looking at piggybacking on that effort and doing Midland Avenue and some of the additional side streets. And the red over there to the right-hand side is part of the New York State DOT project.
Could I just ask
Yes.
a clarifying question?
Sure.
So far right, we've got a big purple block.
Yep.
Is that a single parcel?
Correct.
Is that what?
Yes.
Okay, it's just
So
a
all these are
larger
partial boundaries.
parcel.
Yep.
Okay, thank you.
What about the Brighton project? Would that be in time for this?
Yes, so that includes that. So we got Brighton State DOT is the red line. Engineering's Brighton project is just north of that red line, so you can see a few more purple parcels there. And that blue line there on the bottom, south of the red, is what we just completed as part of our Brighton pump station and water main project. And we had 3 or 4 lead services on there that we replaced as part of that. Again, over here on the west side, coordinating with engineering's projects, we want to do some water main lining or replacement on Geddes and some of the side streets. And then we've coordinating with the new 15th Ward effort that's going on with redeveloping that section.
Right, is it possible to move it that way? We like.
Oh,
Can't-
because of the column
yeah.
of the, okay.
Right, is it possible? Yeah. Oof, that's
Oh,
not good.
I'm done.
Your light's back on in the front.
I gotta log back in.
Okay, then never mind. If it comes back.
When it comes back up, I can log in and show you the last couple slides, but what's remaining there, we went to the south, we were on the west, talking about the west over by West Woodland Reservoir. That's another old section of the city. And the other projects we have on our plate coming up this spring is the Brookford Pump Station, the Westminster Pump Station, and the Guilford Pump Station. And we've identified Westminster is identified as lead, most of the parcels there, and miscellaneous parcels in the Brookford and Guilford zone.
So with your comprehensive plan that you have with each quadrant of the city, of course, each quadrant does discover and have, poverty, Are any of these parcels, are they identified with one of the most impoverished parts of the city that don't have the lead services that needs to be corrected, or is it just a straight plan across the city?
So right now, we're just trying to do the dig once approach and catch up with the streets that are already going to be tackled. We're already coordinating with DPW on road recon to see if there's some, roads in there that we can get into as well. So really, we're playing catch up with the other departments. Because we could go, I don't really want to go into streets where it's either it was paved just last year for one single service. So we want to kind of cluster these projects together as a bigger project.
Can I go back to when I entered? You were talking about EPA thresholds of
Yes.
15 parts per million, and that all of our water service is below that threshold. If we know we have lead service, how do we get below that threshold? Do we have processes that?
So yes, we
that filter
currently
or
treat the water. So basically, we have a treat. We add orthophosphate to the water to help, for lack of better terms, coat the inside of all the pipes. So as it comes into the house and through the surface, the orthophosphate creates a coating, a protective barrier, so the lead doesn't leach out into the water. So that's what we're doing currently, and that process is working.
What's wrong with that process?
Nothing.
So then, why do we have the push to replace the lead services if we have a process that gets us to the desired outcome?
EPA is looking at lowering their threshold, and they also would like to, one of their goals is to remove all lead services within 10 years. So we're being proactive before we are mandated. Be proactive and start doing our due diligence to remove these.
If there's a mandate down the line, do you anticipate additional state and federal funding for the replacement?
I
Rather
would hope
than-
so, yes,
Rather than
right.
being proactive, is there an approach where we wait until a mandate and then recoup more of the expense?
I think if we wait for a mandate, everyone's gonna be waiting to get in line. I'd rather get in line first instead of be at the back of the line.
Thank you.
Want me to log in again? Let me try and see if it works.
Blame Counselor Majoke for that, too.
No, the big map. Yeah, thank you. Right. I mean, that's the way, yeah. And that's the development patterns of the city, is what we're looking at. You know, like, we are now dealing with spatial patterns that were started 100 years ago.
Well, a minute here. Welcome. Gotta get right in the middle. 'Cause y'all know how to act.
So I think this was probably the last slide, I think. Yep. So this is the east side project that we're looking at. Again, the gray boundary is our investigation zone for our inventory. Now, the inventory is what is required by us from the EPA and New York State Department of Health to provide a public-facing portal of everybody's service. They can actually go in and find their house and look it up and see what they have public and private side. That is due October 2024. So as part of these capital projects, we're doing investigations along with that.
Along with the investigations, plus you want to do 2,200 services with over the next 5 years, right?
Correct.
And then the investigations would then go the following, is that
So
your-
investigation, we have to update that regularly as we find information to post it. So right now, I think we have like 96% of all the public side identified. One thing that we haven't tracked, so we've never been required to, is private side. So as we are going in and doing work, such as meter repair on these meters, our guys are identifying what's on the inside of the house, and we're documenting that. So that's one of the next steps we have in front of us, to see what we have on the private side, and then what we don't know, and then start putting out communications to that section of town of like, all right, we're gonna be coming through, we're gonna be doing some investigation. We'll also do some communications through pamphlets, so people can do self-identification. And if they can identify it themselves, they can come to the website and put the information in for us. That way we can get as much information as possible. Any other questions?
So with, related to Councilor Williams' point earlier about inside pipe coating and all of that, have we, sorry, I got excited, okay? Have we, so far, as part of the DIC ones, have we replaced anything?
Yes.
right?
So on Butternut was part of that Dig Once approach, we replaced all the lead surfaces on, see if it shows it here. You can kind of see it, but, you know, West Genesee Street was kind of that Dig Once approach. We replaced, I think, 90 lead surfaces on that stretch. We have another couple projects that we're coordinating with engineering on, such as like North Beach Street.
And out of those identified right there, obviously, those are the pipes that we have not touched yet, right? It doesn't include,
Right.
okay.
Whenever we come across a lead service, by either putting in a new water main or doing work on that street, we will replace that service completely.
And this may be something you have not identified it. Do we know how, in the last 5 years, what's the percentage of the pipe that was identified as lead that has been replaced? And
That's a good question. I don't have that number.
Okay.
But I can look into that.
okay,
Because I know there was a big push back in 2004, 2005 to start replacing lead services, but they were only what they called partials. They went to the curb box, and the homeowner had the option of putting their private side on their taxes. And
It'd be
they could
great
pay
to-
it off over X amount of years. The EPA is now saying partials should not be done. There should be a full replacement from the water main to the meter. And all of our meters are typically in houses.
it'd be great to know what we must do, you know?
Yep.
So it'd be great to know that number.
Are we going to be, with the process we currently have, if the EPA does shift their thresholds, will we still be within the new thresholds?
We should still be below the 15, but they may be lowering it's called actionable limit of, hey, you need to start looking at how you're going to start replacing lead services to be 10. So we were going to fall below 15, and we may fall, you know, between 10 and 15. Again, and their sampling procedures are changing also, and that's hard to standardize on because we don't actually take the samples. We give it to the homeowner, and they have to follow these very specific instructions on sampling.
So is the water supply constantly treated with that phosphate? Or
Yes.
it's constant,
Yep.
okay? So it's not like lead paint where you paint over it, it chips off, okay.
What's, along with those questions, what's the lifespan of
The coating.
the coating?
So we treat it every single day, so that way there's no inconsistency or if there's a breakage in the coating, it doesn't start to get bigger. So we treat it every single day, so that way it's always consistent.
Those chemicals have no bodily harm to the public.
Correct. It's one of the approved treatment processes for lead services.
Obviously, that treatment process is costly, right? And if you replace the pipe, you don't have to.
No. We still have to treat because we cannot replace all of interior housing plumbing. So it still goes through all of that. We only can bring it to the meter, and that's where we stop. But if we stop treating, then if there's any lead services in the house, in the walls, that's where
If
you
we
have
stop
the issue.
treating, we become Flint, Michigan.
Correct.
So what does that look like? You know, so we're being proactive on our side, right? And you have to do the communication with the private homeowner. What do they have to do to be more compatible to make sure that everything
So we're developing some communication tools and pamphlets to help identify as we're coming to these homeowners saying, hey, we need to get into your house to take a look at what you got, or we're going to be in the area doing construction for replacement. This is what you can expect. This is, you know, the time frame. We'll give you, 72, 48 hours notice prior to replacing your service. But all those communications we're developing now for these projects coming up.
And do you know if there are resources available for, private, individual community to maybe apply? And because I know you can't get into somebody pipe inside the house, but are there resources available that people could use to really complement what we are trying to do?
Good question.
inside?
I don't know if there's any programs for internal plumbing for homeowners. I just don't know. I've never heard of any.
Yeah, I have a question, far as development. So like on the east side off Genesee Street near Beach, there's a whole bunch of development going on, housing. How does that affect with adding more to the pipes with all those buildings? And are you guys tapping in front of those two new buildings that are like off Genesee, almost near Beach?
So any new developments is using the new materials, such as like if it's ductile iron pipe in the street, if we can, we'll replace it or have the developer replace it. If they need increased capacity, we'll have them replace it with ductile iron. Any services that are over 2-inch in size are typically ductile iron pipes, not, obviously nobody uses lead anymore or galvanized, but copper, we only go up to 2-inch. Beyond 2-inch, we'll have the developer put in ductile iron.
And we watch this process as they,
Correct.
okay, just curious.
Yep, they got to come in, submit a permit application for a water application, then there's inspections that have to occur between county plumbing and us.
You have a starting date? What's your goal? Get this project going?
So we have one project that we just bid out, is the Brookford Westminster Pump Station project.
Okay.
That was hoping going to be starting in April. So we're going to be doing a public presentation for those two groups and identifying, letting them know like when we're coming, what they should expect, and the duration of the project and any kind of interruptions that they should see.
Okay, so it's how many months you think?
So with the pump station project, we're looking, one construction season. What we aren't sure on yet is the lead time for the prepackaged pump station. I've heard it can be up to a year. So they could do all the pipes and all the services, but then we have to wait for the pump station to arrive.
Are you guys in conjunction talking to DPW for the streets? Because I know they're doing neighborhoods and streets.
Yeah.
So
Okay, you already answered that.
Yep.
All right, sorry, thank you.
we are on it.
I think my final question, I believe, is, I always like to think about metrics and indicators of success. Success is we did it, basically. There's not a whole lot of gray area. Or is it that 2,200 services, we only made it to 1,800? Or is it 2,200 proposed and we made it to 2,400?
I think success is getting it done within our budget. And if we can exceed the number that we replace, then that is a bonus.
And so we're going to do the 2,200 period?
Yes.
And it might cost us a little more?
I'm hoping it doesn't cost us a little more. With the competitive bidding and the stuff that's out there, I think we should be able to get to 2,200. And if we have money left over, I say we keep tackling more until we're done.
Thank you.
When you're talking about a neighborhood like that at the top, that Melrose part, with that amount of density right there, when you replace one service, you're getting a whole bunch of houses in one shot? Is that how that works?
No,
Or
one service,
block
one
by block?
house. One service,
Okay.
one house. And
Okay.
as we're going through it, like a lot of these places, is the older part of the city. So they have cast iron mains in there. And one of the things that trying to be proactive is not just, replacing the service. Because when you replace the service, you got to make a new tap in the pipe. And you can't put the tap too far away from the original tap because their water service comes into their house, into that corner of the wall. So you got to bring it to the same spot. So now you're tapping the old cast iron main within a foot or two of the original tap. Having those two taps close by can create a weak point. So I'd hate to just replace the service, then come back 6 months later and replace the pipe because it broke.
Okay.
So we're trying to do both, but that is a very costly endeavor to replace all of the water main and all of the services on each block.
Okay.
That's where we're trying to be very strategic and working with the other departments to minimize our cost for doing that work, especially in restoration and pavement.
And that's some of the highest density in the city right there, that little area.
Yep,
Single and multifamily.
right.
Houses are super close together.
That's one of the other things we're doing. I'm not sure if we talked about it, but we're replacing services up to 1 inch, which is your typical residential service. So like the big apartment complexes, they have a bigger service. So they're typically not looking for the grant program to do that. We're targeting single-family homes, residential, not apartment complexes.
Do you foresee any major issues? Because you're saying these are so old, like, have you wiggled budget a little bit for some
we have some contingency money in our budget for
Okay.
unforeseen conditions. That is a good measure to always have.
We still have a big issue with lead in homes and apartments that, that are not updated. And I think
Internal plumbing,
Right,
is that
in
you're referring
buildings, so
to?
we really have to enforce it and remove these leads. Otherwise, we're just not be successful. Fine, we got a lot of lead.
I mean, it certainly doesn't reach the point, it doesn't reach the danger that we have with lead paint, though. I mean, those are two very separate animals. I want to
Correct.
make sure that we're
Yes.
clear there. Like, we're not in a situation where we have lead pumping through the water pipes and these kids are drinking it every day like some cities, unfortunately. But the lead paint is a very different animal. That's,
Correct.
yeah.
So, back to the dollar side, my last question. We're going to apply for the grant first to get that before we apply for the loan? Is that what we're gonna do?
Yeah, because this is stretched out over several years, there's no point to be paying on a loan that we haven't used yet. So that's what we're looking at. The project that we've kind of identified as a whole right now is the $40 million project. State kind of wants to see that, like, all right, you have now made effort to go forward with a $40 million project. Financing-wise, it'll be a series of different things. It'll be bonded, zero-interest loan, and we'll work with the finance department, budget department on how we can make this work and what the shape of it look like.
And and I apologize because I missed the first few minutes, so if I repeat it, just say it's already answered, and I can look at it. But, and you're saying the water department is going to handle all this? Your
So
man.
some stuff we will handle in-house, but if it's capital projects, that will be competitively bid out, especially if we're going from the water main into the house. That liability of working on private property, we're gonna shift to the contractor, so it's not on us.
Okay. Thank you.
You're welcome.
Questions?
Any other questions?
Is that the deputy commissioner there? Sorry, we never got a chance to meet you. Nice to meet you. Pleasure. Yes, sir.
Good afternoon. Peter Maroon, with the Common Council Office. Commissioner, I was taking notes. I want to make sure I got this correct. You said the focus is primarily on single-family residential?
Correct.
So we're a city of, I believe, 72% rental? How does that,
So, I mean, the structure, like a residential structure, a house, we're not focusing our efforts on big apartment complexes, but if it's a rental house, again, that'll be, as long as it's a 1-inch service or less, we'll be looking at that. 1-inch service size. Yeah.
so
It could be multifamily,
any
yes.
multifamily would be included?
Correct.
You mean single service residentials versus, you don't mean single occupancy? like-
Right, correct.
Okay.
Yeah,
So two families have a single water
Right.
service, 2 apartments.
right.
Okay, thank you for that clarification.
Sure.
All right, no further questions, or comments, statements, or anything? We're just going to conclude the meeting. Thank you for everyone. Thank you for coming. Appreciate it. I'm tired.
Thank you.
I know.
Nice to meet you.